Yeah, so just remember it was Jeremy that said you're not the new kid on the block. So
That's 3 times.
there's people that you hear about before you meet them in real. It's like the Doppler effect, And Dr. Tony is one of those people, and I also thought, well, I'd probably like him if I ever met him, and we met a long time ago, and I did like him. And he's going to talk about ionic calcium, and I'll let him get into that. But I just want to say that, there's things that I do actually check almost everything out that we talk about. There are things that sometimes I look at like 4 or 5 or 6 times before they start to sink in and pass my BS meter. And this was one of those things, not because I was prejudiced against it, because it didn't make a lot of sense the first time I looked at it. And I just tell you personally, and they are not giving me anything to say this, I've used it with some people with some pretty significant immunodysregulation, so trying to get immunoregulation back to them, where we're doing a lot of other things. And I've been very impressed, and Tony's going to talk about mechanisms and things like that, but I just wanted to say that. And so Tony did graduate, got his MD from the Autonomous University of Guadalajara, and he's also a naturopath in Mexico as well. And he's traveled the world looking for any way possible to improve the lives of cancer patients, and that's what he does. So thanks a lot.
And can I just add that the company Prenuvia have sponsored Dr. Tony for this talk this afternoon. It's non-CME, so open floor to say whatever you like. So over to you, Dr. Tony.
Whatever.
So you want to stand up for a second or two just to stretch, or you're good? All right. So since I could say anything, I will say a bad joke. And the joke is that, did you hear that today in a Scottsdale bank, calcium was fired? And the reason is they say that he could only make a deposit. And so what we'll hear about is that we're really depositing the calcium in our tissues and our cells. And so we're living as calcified beings. And this is the foundation of what we're talking about when we mention calcium signaling, dysfunction, and ionic calcium therapy in oncology. So we know our good friend, Dr. Tom Levy, JD, MD, he said, all chronic degenerative diseases feature increased extracellular and intracellular levels of calcium. The increased intracellular calcium also results in increased intracellular oxidative stress. Big statements. And we know that, the functions of calcium ions in our body are multiple, and it's the most important mineral and the most abundant mineral in our body. 85% of all the minerals in our body is calcium, 85%. And so what we need to remember here, and you'll hear it over and over, is that this function of calcium signaling causes our cells to dysfunction. This function of calcium signaling causes our cells to dysfunction. If we look at the works of Dr. Nicholas Gonzalez, anyone heard of Dr. Nicholas Gonzalez, right? He, in his metabolic typing, he says that most cancers are sympathetic cancers. Those are the solid tumors. And the minority of them, the soft cancers, are parasympathetic. The multiple myelomas, the sarcomas, the melanomas, and the lymphomas and leukemias. So in Dr. Gonzalez's work, it was to balance the parasympathetic and the sympathetic. And so the sympathetic cancers, dominant sympathetics, he never gave calcium. It was only magnesium and potassium because it would drive them more into sympathetic. The parasympathetic type cancers, he recommended calcium because it would balance them and drive them a little bit more to the sympathetic side. But that was with the calcium that we know as physicians and we get through supplements. But when we're talking about ionic calcium, it's the subject today, We can and we should provide this calcium to all types of cancer because we're going to get a metabolic autonomic nervous system balance, I should say, in sympathetic and parasympathetic. So here we see that bone loss leads to 150 plus degenerative diseases. On the left, you have cellular calcification, and that's at the foundation of health, because if there's cell calcification at the cell level, then we have it at the tissue, ultimately at the organ level, and finally at the systemic level. It drives oxidative stress, calcium signaling breakdown, mitochondrial dysfunction, cellular inflammation that obviously pushes us to degenerative diseases, right? And remember, our cells in our bodies are information pathways, and we're signaling pathways. This is why whether we do acupuncture or we do nutrition to get rid of excesses and get nutritional needs for deficiencies, what we really are working on is information pathways, the signaling, so that the cells can do what the cells need to do. Here was published about subtle dysregulations of calcium ion signals have been linked to major diseases such as cardiovascular diseases, bipolar diseases, schizophrenia, and Alzheimer's. With respect to mitochondria and calcium ion bioregulation, we know that excessive calcium ion concentration inside the mitochondria produces ROS, free radicals, that damages DNA, RNA, and proteins. And this damaged mitochondria upregulates fermentation-based biochemical processes that generate lactic acid. And we know that's one of the big theories of cancer and carcinogenesis, right? So what we want to do is we want to restore calcium bioregulation, because by doing this, we reverse that damage and normalize metabolism. So let's talk a little bit about the principles of calcium regulation. We know that calcium supplementation can produce many health risks. I know any of you had a CT calcium scoring test, right? It's a 5-minute or so scan of the coronary vessels to see if there is calcification. We should all do that when we're 40 or above. But with ionic calcium therapy, we don't have that problem, and we'll see why. And here, we see that the basics of this slide is to say that safe amounts of calcium ions are needed and necessary for chronic conditions. And calcium ions going back into the bone and reducing the serum hypercalcemia is very important. So here we see that dosing is important, and it's important to get the serum levels of calcium up, but we can't do this with supplements safely. And so when we're talking about ionic calcium supplementation, we're really talking about low dosages of ionic calcium that will prevent and reverse hypercalcemia and calcification at the tissue level. So we get all these glands working better with respect to the parathyroid. I don't know if any of you, for bone mets, maybe years ago, we gave calcitonin and calcium glutamate, right? We did that. That was an old German therapy for bone mets, where we give IV calcium glutamate and then we follow that with calcitonin so that the bones can reabsorb that calcium. But here we're doing this naturally, and something we could all do in our offices without having to do IVs and the risk of anything, side effects with calcitonin injection. So we're really triggering physiological responses by providing ionic calcium supplementation. Here we see this was data from a collaborative clinical work with the Calcium and Bone Health Institute and the University of Arkansas Medical School in the US. And to get to the bottom of this on the right, restoring calcium balance, typically there's elevated serum calcium ions, the pituitary gland releases a TSH, thyroid releases calcitonin, we have an increased bone turnover, and then there's a body-wide decalcification, and we're storing calcium balance. And of course, that's what we need. Remember, at the cell level, then it's transferred to the tissue and also then to the organs. And remember, once we're doing this, we're enhancing that cell function and we're getting better oxygenation at the cell level. We're getting better detoxification at the cell level. So these calcium ion signaling is providing ideal cellular health. In this slide, we see what happens when there truly is cellular decalcification and the healing pathway. So we're going from left to right to get an ideal pH, optimal oxygen delivery. We're turning off those autoimmune hyperresponses, and we're reducing chronic inflammation. And at the same time, we're building stronger bones. So it's really a technological revolution in calcium delivery, and it's called anti-orbital ionic calcium, AIC. And here on the left, you see an ionic calcium carbonate molecule as compared to the regular calcium carbonate on the right. We see that there is a weak anti-bonding bond between that calcium ion. We're creating an electrical charge. On the right, those are ionic bonds. And so this is why when we take calcium supplements, a lot of it is not absorbed. It just, settles in the interior vessels and other tissues, and that creates a problem at long term. So it's 200 times more soluble, 3 times faster in signaling chemical reactions, and we get osteoblastic synthesis. So the beauty, as you see here with AIC, anti-orbital ionic calcium, is that it's passive transport. It's direct absorption with water. This product has to be taken with water, and a lot of it, so it could passively diffuse or transport it into the cells in the bloodstream, because for calcium to be physiologically active, it has to be free in solution. And it's stated that 40 to 45% of calcium in our body is protein bound. And so that's not utilized by the cells. So what we want is that we don't need digestion. We're freeing up these calcium ions and being absorbed by cells very easily. So when I first looked at this slide, I thought, wow, this is a magic bullet. And we say, hey, how could anything, help all these pathologies? But it's not about that this is going to reverse autoimmune diseases or mitral valve prolapse or Meniere's. It's just that it's providing that signaling pathway so that physiological pathways happen in the body, and then health improves. Isn't health kind of simple, right? It's sometimes we make it too complex. So here we're going to show a patient who had calcific tendonitis. They're in the right shoulder area, and then disappeared 16 months later. So strong bone building and decalcification effects of AIC clears the cellular calcification. I'll say that again. Strong bone building and decalcification effects of AIC clears the cellular calcification. The most dangerous calcification that we can be exposed to is, not having this calcium absorbed, and it really can be considered one of the main root causes of disease, including cancer. And so for this to happen at that bone area, it had to start at that tissue level. And here's a magnification of the effects of decalcification of AIC therapy. I have my radiologist, interventional radiologist, look at this because I wanted to make sure that I'm presenting something to you, that was vetted a few times by radiologists. And this is kind of unique because my biological dentist friends, they say that reestablishing and rebuilding vertical bone in the jaw is very complex. And it's one of the challenges for biological dentists. It gives them more gray hair. The horizontal bone growth is not that difficult. And we see with AIC that it helps restore and maintain your oral health, create strong jaw bones to support the teeth, great for patients undergoing dental transplant and or implants, and significantly promotes the formation of cementin. And in those images you see there from day 1 to 10 months later, there's a significant increase in bone mineral density in that bone where a tooth was extracted. Here's, something else, kind of the same story. This was osteoporosis induced by steroid use, and the same thing in a relatively short amount of time, the patient had good callus formation and no evidence of fracture. We know that about 40-ish years of age, we have the maximum bone mass, right, both males and females, and that declines with age. So, we're all young in this room, so I encourage you to look at this even further and consider where your calcium levels are now, if there's calcification in your body, and that needs to be reversed now, not tomorrow, because it's only going to increase, and bone mass density will continue to decrease normally. And here, the Calcium and Bone Health Institute has data for over 1,000 cases of osteoporosis or osteopenia that were treated with calcium ions with very high overall success. And remember, in a DEXA scan, the T-score that is -1 or greater is normal. Between -1 and -2.5, there is osteopenia, and below -2.5, that's when then there's osteoporosis. And in these 3 patients here, you see that in a relatively short amount of time, there was significant improvement either from osteoporosis to osteopenia or back to normal. And we've been doing this at our center also. We have, Hope for Cancer has 2 centers, one in Cancun and one in Tijuana. So we do a bone density test on all of our cancer patients, and we're seeing clinical improvements usually within 6 months. Some patients sooner, depending on their diet, their regimen of exercise and sleep and things like that, that always have to be a part of ionic calcium therapy. So now switching to oncology, I like the lectures that we've heard, because on the right here, these are what Dr. Hanahan and Dr. Weinberg published back in 2010 and revisited in 2011 when they talked about the characteristics and hallmarks of cancer. Independently of what cancer type there is, we see that there's proliferation, there's migration and invasion, angiogenesis, escaping the immune system, and shielding themselves, hiding themselves from immune recognition. So here we're showing that calcium ion is an important signaling mediator that controls many of the biochemical processes significant in oncogenesis. So this is one of the reasons that for the last, since 2018, we have been using ionic calcium in our centers. And I was exposed to this in Singapore. I was working with Ty Bollinger and The Truth About Cancer. We were filming the Eastern Medicine documentary, and it wasn't an accident. I met the guy that distributes this in the world, and since then it's been part of our protocol. So indications for AIC therapy in cancers of all types. Why? As I just said, the mechanisms of cancer are similar to all types of cancer, right? So when someone comes to us, it's not about treating a rhabdomyosarcoma or anaplastic small cell ovarian carcinoma. It's about working at the mechanisms of disease. And that's one of the things I like about AIC is we're working on what should affect normal physiology, is that calcium signaling. So what are some of the effects of cancer and AIC? We know that calcium ion creates an alkaline environment that counters the immunosuppressive cancer-favoring metabolite lactic acid. So in essence, AIC has that alkaline effect, if you will. You know, we're taking the patient out of acidity and driving them more into alkalinity or balance. And secondly, calcium ion combines with the cancer cell metabolite ammonia. This prevents the formation of excess glutamine, and this is used by cancer cells, as you know, as a source of energy. Mostly all cancers, but we know for sure glioblastomas and other brain tumors use glutamine quite well. And then thirdly, and we talked about this, we heard about this today, right? The P53, the guardian of the genome. Every tissue in our cells has P53, and we know that cancer cells suppress P53 expression. And so with AIC therapy, we're able to maintain normal mitochondrial function, reducing oxidative stress, and at the same time, upregulating P53 expression. This is huge. We heard before that, you know, a certain percentage of cells have P53 mutations. I believe, I can't prove that, but I think most, if not all, cancer cells are able to suppress P53 expression. So here are 3 case studies. One is a patient with multiple myeloma, and this patient, 80 years of age, she was diagnosed in 2012, and she has been in remission. She was followed for 5 years. 2017 was the last time she was contacted, and she was treated after failing conventional therapy. She was treated with AIC, and here it's showing you what's happening with platelets, WBCs, and neutrophils. This is not one of our Hope for Cancer patients. This was a patient provided by the AIC group. And then individually, we could see the white blood cells, you know, increasing throughout time, neutrophil, platelet increase, and then on the bottom right, we see the bone density and the GFR increase in this patient, going from a T score of minus 3.6, truly osteoporosis, to minus 0.9. And at 80 years of age, right? So that's significant. This is a stage 4 lymphoma patient, and all of her symptoms improved when she started what is considered the therapeutic dose of AIC is 5 mLs and 500 mLs of water 4 times a day. For prevention, we could do 5 mLs and 500 milliliters of water once a day. We had a patient recently at Hope for Cancer in Cancun that had a kidney, a renal cell carcinoma, and he had Parkinson as well. And he came with his son, who's a rehab physical therapy guy. And about a week and a half later, in consult, the son said, you know, Dr. Tony, my father is walking better on the beach. And, you know, to walk on the sand with Parkinson is not very easy. And so we weren't treating the Parkinson. You know, the renal carcinoma was a big issue, but he improved with the Parkinson too. And then the more I looked at him, I saw that his tremors were better, his speech was clearer, and his gait was much improved. So that was, once you see it, and sometimes it speaks better than all this information. And this is one of our patients, carcinoma of the right breast. This was a triple-negative breast cancer, also an 80-year-old patient, extensive metastasis to bone. And her history, you see there, medical personal timeline. In March 2007, she had all the scans done. They were clear. This was just like preventively. She had these scans done. I don't know why she had a bone marrow biopsy, but they were expecting something. She had a thyroidectomy, which was benign. She had a hysterectomy because of fibroids. And then in 2017, the loss of her husband. How many times have we seen a sudden unexpected traumatic shock experience lead to an onset or an aggravation of disease, right? And for sure, we see it in cancer. And with right breast, in this patient's case, that's the male side for a right-handed person. And so we know there's a deep male conflict there. A quick story, I had a patient, Phyllis. She was a school teacher and she had right breast cancer. And for years we were treating her and she was okay, she was functional, she was teaching, but the tumor was still there. But I didn't know this stuff about, you know, the emotions and cancer. And then I got into it more with German New Medicine and recall healing and all that, all those people. And so I approached Phyllis and started asking the right questions, right? And it happened that when she was 11 years old, she was sexually abused by her father, her uncle, and her grandfather. And so Phyllis was about 60-ish now, so for about 50 years, the three of those knew, she knew, and now I was the fifth person to know. And once I started working and her letting this go, what happened? The tumor went away. So please, that's a side note. I know we all know this. I'm preaching to the choir, but never, ever do not work on a patient's emotional stuff, right? We all have that backpack of stuff, and this is very, very important. So going back to this patient, then in July 2018, she was diagnosed with carcinoma of the right breast and mets to the bones, T9, T12, and the rib cage. Here are some of the images that you can see. Improvement on CT scan, reduction of that lytic lesion. This is the T10. And here you see involvement in T12, L2, and L5. And the T12 was smaller, no evidence of the lesion in the L2, and positive response in the L5. This being said, we don't treat monotherapies, right? We're a multi-treatment approach because we know that cancer is multifactorial disease. And so this patient is advised with nutrition, detoxification, oxygenation, immune modification, microbiome work, behavior, emotional, and spiritual therapy, and one more I forgot. I'll think about it. So, see, I'm being pressured. I have like 1 minute and 30 seconds left. So here we see the two lytic lesions in the vertebral body. And almost a year later, no evidence of disease, right? Now we look at the sacrum, the same very good response as you see there. And so this patient is one of our patients. The last update was September 21st, just not long ago. Patient continues to do well, even though still dealing with active disease. The next CT scan is scheduled for later on in October of this year. As Paul was saying, and I really love that, quality of life is the first thing we need to work on a patient, right, is to improve their quality of life. I don't believe that no pain, no gain. I believe that that's an old premise in oncology. Patients should feel better, and it is our responsibility to make sure that they're not getting these healing crises and things like that. So quality of life, very important. Continued research is happening with the AIC group. There's this book called AIC for Calcium Signaling. There's the website, and what else? This is my book, Hope for Cancer, 7 Principles to Remove Fear and Empower Your Healing Journey. It is on Kindle, and the hard copy will be out in another, well, not out, but the reprint is coming in 3 weeks, I'm sorry. So now only the Kindle is available. And for more information on the AIC therapy, you could go to booth 17, and Jay Lee and Jason and myself will be there for any questions. So thank you, and blessings to you all.
Thank you, Dr. Tony. Terrific. We appreciate it.